Hello everyone, welcome back to my channel. So in today's video I will be talking about blood donation. I've been having a lot of questions when it comes to this particular topic. So many people will come to the hospital maybe during their blood extraction, because at times I do work as a phlebotomist. So at times many people will come to the hospital and I want to do them blood extraction. They'll be asking me, oh, it's like this, I will really want to donate blood. What are the things I have to do? What are the things I'm supposed to do? Or what are the necessities that will enable me to be able to do blood donation? So in this video I'll be telling you all the things you are supposed to do and what are the basic requirements for you to be able to do blood donation. So stay tuned. My name is Yvonne. If this is your first time watching me, please don't forget to like and share this video. It's very important because many people out there that are really in need of blood, but they don't know how to get them, or they are finding it difficult. You have a lot of people with different blood group, different blood types, so it becomes a little bit challenging when someone is really in need of blood and maybe the blood type, or maybe in the blood bank they don't have the particular type of blood for them. Meanwhile, there are a lot of people out there who really want to do blood donation, but they don't know how to go about it. So kindly stay tuned. I'll be giving you all the tips that are needed for this. And also, one thing you have to understand is that donating blood, it's a good humanitarian act. You can equally not have money to help the needing out there, but there are a lot of things you can do to help the needing patients that are in the hospital, like for example like doing this blood donation. So doing that alone, it's going to help the needing patients that are out there, maybe those that had accident and they are bleeding and they need urgent blood donation, or maybe during surgery those that happen to lost a lot of blood. Equally, they need also extra blood from the blood bank. So when you do this blood donation, it's going to help you also. It's going to help reduce the possibilities of you having heart disease, stroke, and it's also going to help your bone marrow to help build you new red blood cells. So it makes your bone marrow to be active. Your bone marrow is the cell in your body that takes proper care when it comes to the production of blood cells. So you donating blood will in turn reduce your possibility of having stroke, heart diseases, and your body will help manufacture new blood cells. So it's going to help you towards that aspect, and above all, it's a humanitarian act, so you are helping and saving a lot of soul outside. Blood is not something that can be manufactured in the lab like any other product, or maybe any kind of medications like we can just go and purchase them. No, it has to be done by someone. So you are equally saving a life. You have done already a lot, and there are situations that you might need them even without knowing, like in the case of an accident, you go to the hospital. Imagine that you have never done a blood donation before, and at that crucial state your family is expecting someone to be the one to save you with your blood. So you sitting at home and you think you have all of these requirements that I'm going to list here, you can equally check in the hospital, or you go to any center. As long as you are physically fit, you can do blood donation there and help someone in need of it. Most of the times in the hospital, people will ask me, how can I really do this? I really want to do this. I'm going to be telling you all the things you can do irrespective of where you are. I think this basic procedure, most of the hospitals around the world, they do follow them. But once you visit any center that is doing blood donation, they are going to tell you with respect to their specific requirement. But the first requirement I'll be talking about is that you have to be 18 years and above. Most of the times that's the requirements for many countries. You have to be 18 years and above. And the next thing I'll be talking, you cannot be a minor and you want to do blood donation. It doesn't work like that. You have to be an adult, which is being an adult, you are already 18 years and above. The next requirement is that your body weight has to be 50 kg and above also. You cannot be less than 50 kg, then you are going for blood donation. And the next thing is that you have to go for medical checkup. You have to be medically fit. When I say medically fit, what I mean is that you cannot be pregnant then you want to do blood donation. It will not go like that. You are compromised already because you are carrying a baby, so you cannot do blood donation at that state. And you need to be medically fit in a way that like you are not on any medication, like you are not a cancer patient, you are not a diabetic patient, and maybe you are not HIV positive, those kind of, or you are not on chemotherapy, you are not taking any kind of medication also. So that is what I mean by you should be medically fit. And also at times the doctor is going to have some kind of interview with you. The doctor will ask you, have you traveled in any endemic country, like for example country that has some kind of pandemic at the moment, just to be safe when you are doing the blood donation. So they are going to ask you all of those questions. Are you on any kind of harmful drug, like maybe marijuana, all of these kind of drugs? So the doctor is going to ask you also those questions to be safe. You are going to help someone, so definitely the doctor has to check on you to make sure you are not indirectly killing this patient. So those are the kind of things, and also you are not indirectly killing yourself. So you have to be medically fit before you go for blood donation, and your weight should be more than 50 kg and above, and you should be an adult, that's 18 years and above. And the next thing is that your blood pressure and your pulse rate should be within normal. For your blood pressure, it should be within 50 to 50 on 100 to 90 over 180 millimeter mercury. So that's the range in which it should be. And your pulse, like the rate at which your heart is beating, it should be normal. So all of those things are going to determine if you are a good candidate for blood donation or not. Also, your body temperature should be within. You cannot be going for blood donation and you are very sick, or maybe you have a high body temperature. So all of those things are going to contribute. So now, depending on your state or whatever country you are in, they are going to run more other tests, other blood tests, to confirm if you are physically fit. Some countries might give you benefit when you do blood donation, some might not. It depends on the country. So each country, they have their own rules. For my country, Cameroon, when you do blood tests, you can do blood tests at every 6 months. Every 6 months you are allowed to go and do another blood test, unless it has changed. I think 7 years ago, when I was doing internship, when I was still back in school, that was the requirement for you to do blood tests. Like every after 6 months you can come for a blood test. And in case if you have your family member, your direct family member that is in need of blood tests, family member goes to the hospital and the patient is in need of blood transfusion, definitely you are not going to pay a dime, because you have always been a regular blood donor. So those are some of the kind of benefits they give for some people, like in the situation in my country, which is Cameroon. So it's really good to do blood donation. It takes nothing from you, like I've said. As long as you are physically fit, you are equally helping a life out there. At times it's so challenging, like back in the hospital when I'm in the laboratory, you have someone coming which the person is really in need of blood, but they cannot do it immediately because in the blood bank you don't have that particular blood group. Because when it comes to blood type, they need different types of blood type, and there are some kind of blood groups that are very scarce. So people will keep coming for blood donation, but you don't have that particular blood group. People of that particular blood group, they don't come for blood donation. The people who are coming maybe mostly for this particular blood group. So that's why it's advisable, like each and every one, time and again, you can go to the hospital. You can do it once yearly. It will also help you, like I said. It will reduce the possibility of you having stroke, any blood stroke or heart disease, and it's also going to make your bone marrow to be very active. So imagine you or your patient having an accident and they lost a lot of blood, or during surgery they lost a lot of blood, and in a very small rural area, maybe in their blood bank they don't have the blood type to give that to your patient at that particular moment, and maybe they have to call another sector or maybe another facility for them to check maybe if they have that particular blood type before they are bringing it to your facility to give that to your patient. Maybe by then, maybe the patient will be no more. So please, you can equally go to the hospital and do blood donation. It's not something that is really complicated. As long as you are physically fit, you can help somebody. You can equally help somebody. So you mustn't help by giving someone money if you don't have. That's a simple humanitarian act you can equally do out there. So stay safe, and remember, I love you all. Ciao. And don't forget to like, subscribe, and share this video also. Ciao.